Hello there, my listener. My name is Nath, and in this brief video, I would like to talk to you about Get Smart. Improving antibiotic use starts with you. Now, as a way of introduction, I would like to re-emphasize the fact that using antibiotics wisely is the best way we can ensure that antibiotics work in future when we inevitably need to manage bacterial illnesses or infections, and that we need to prevent unnecessary side effects from occurring through wise or judicious use of antibiotics. Remember, antibiotics aren't benign. They can cause side effects such as rashes, diarrhea, vaginal thrush, or oral thrush when we use them, especially the very broad spectrum antibiotics. So it starts with preventing infections in the first place. When infections don't occur, then there is no need to use antibiotics, and we can prevent such infections from occurring through hand washing, through use of personal protective gear when nursing patients with infections, especially those caused by drug-resistant bacteria. Now, as we know, vaccines can be very key in prevention of infections, and I would like to emphasize the fact that vaccines help prevent infections that may require the use of antibiotics. Now, vaccines such as the pneumonia vaccine prevent pneumonia from occurring in the vulnerable population, such as the very young or the very elderly. So they are very beneficial in this regard. Now, vaccines also prevent the spread of these bacterial infections in the general population. Now, I cannot overemphasize the importance of hand washing. Washing your hands is one of the best ways to keep yourself and your loved ones healthy by preventing the spread of germs which may cause infections. Now, simple acts such as washing your hands with water and soap, or through the use of alcohol rubs, may effectively keep down the population of bacteria in your hands, minimizing chances of infection. So when you suspect infections to have occurred, I would urge you or encourage you to ask your healthcare providers about symptom relief, and avoid pressurizing your doctor or your healthcare provider to prescribe antibiotics for you. Instead, I would urge you to ask for the best treatment for your illness. Now, talk to your healthcare professional or the pharmacist about how else you can relieve symptoms so that you can feel better. Now, antibiotics aren't always the answer to your infections. Remember, they don't work for viral infections. So if your infection is a viral one, antibiotics may not be effective. They may end up increasing your cost of treatment unnecessarily. So, my dear listener, I would like to urge you to only take antibiotics for infections that are caused by bacteria. Remember, illnesses caused by viruses like the common cold and the flu and many other upper respiratory tract infections do not improve at all with the use of antibiotics. Using antibiotics when they are not needed can cause harmful side effects, and By extension, they may make these antibiotics less effective against certain bacteria. So when you seek medical advice, I would encourage you to boldly ask if watchful waiting is the right option for you. Even some bacterial infections like mild sinus or ear infections, in children especially, can get better without necessarily treating them with antibiotics. For some illnesses, your healthcare professional may recommend watchful waiting. Now, watchful waiting is waiting for a few days to see if you, your patient, or your loved one, who may happen to be a kid, may get better without the use of antibiotics before deciding on whether to administer them or not. I would also like to encourage you to ask about side effects when you seek medical attention. Talk to your healthcare professional or your pharmacist about potential side effects that may occur when you use antibiotics, as this helps you stopping treatment prematurely, since you'll be better prepared for the likely side effects that you may encounter. And your professionals will equip you with coping skills. They'll advise you on how best to handle this side effect. Now, I cannot overemphasize the need to take your antibiotics exactly as prescribed. Even if you feel better after a few days of treatment, do not skip doses and do not stop taking your antibiotics early without the approval of your healthcare provider, since treatment may fail in such circumstances. Remember, the antibiotics may fail to work effectively in the management of your infection, and the infection may persist even as you take those breaks and give the existing bacteria a chance to thrive and proliferate. So clear your prescribed doses, please. And when your antibiotics are left over, my advice to you would be to discard them. Never save your antibiotics for a future illness, since the future illness may be caused by different strains of bacteria that may not be susceptible or sensitive to this particular antibiotic. Apart from that, avoid taking antibiotics prescribed for others, since they may have been managing infections caused by different bacteria from the ones that have infected you. Apart from that, avoid sharing your antibiotics with others, as this may lead to undertreatment. So I would like to re-emphasize the need for you to talk to your pharmacist about how to dispose of any leftover antibiotics. So, my dear listeners, I would like to urge you to judiciously and responsibly use the few remaining effective antibiotics that we have at our disposal. Now, antibiotics aren't an answer to all infections. Remember, they are ineffective in the management of viral infections such as the common cold, flu, and many other upper respiratory tract infections, 90% of which are caused by viruses. So let's be responsible stewards of these finite resources that we have at our disposal. Thank you very much. And dear listener, if this video helped you in any way, make sure you give it a thumbs up and subscribe to my YouTube channel. The best is yet to come. Thank you very much for watching, and have great antimicrobial stewarding. Thank you.